Hello guys, welcome back to my channel. In this video, we are going to study about cephalosporin. So, what are cephalosporins? Cephalosporins are also a beta-lactam antibiotics, which we have already studied in our penicillin video. So, the mechanism of action of cephalosporin will be same as that of penicillin that we have already studied in my previous video. Another important point about cephalosporin that it is less susceptible to beta-lactamases and it is of course a bactericidal drug just like penicillin. So, one important thing about cephalosporin is that this whole cephalosporin drug class is actually divided into four classes of drugs, means four generations of cephalosporins. So, we will study about each and every generation selectively. But before we start the generation wise classification of the cephalosporin, first we have to know what are the organisms that are not covered by first to fourth generation cephalosporin. And this can be remembered by LAME. L for Listeria monocytogenes, A for atypical such as chlamydia and mycoplasma, M for MRSA, methicillin resistant Staphylococcus aureus, and E for enterococci. So these are the four drugs which are not covered by first, second, third and fourth generation cephalosporin. So this is a very important point which is often tested in examinations. Another important point about cephalosporin is that the gram positive and gram negative coverage of these cephalosporin drugs. Remember that I already told that the cephalosporin are divided into first to fourth generation class. So one thing that you have to remember, in general, the gram positive coverage of cephalosporins decreases as we go from first to fourth generation, and the gram negative coverage increases as we go from first to fourth generation cephalosporins. Now coming to first generation cephalosporin. So what are the drugs that come under first generation cephalosporin? These are cefazolin and cephalexin. You have to just remember it that they are cefazolin and cephalexin. There is no trick to remember it, or there is no concept behind it. You have to just remember, rote learn the names of these generation class drugs. So what is the coverage of first generation cephalosporin? That is cefazolin and cephalexin. These are gram positive cocci, Proteus mirabilis, E. coli and Klebsiella pneumoniae. So, and what is important about cefazolin? Cefazolin is used prior to surgery to prevent staphylococcus infection of wounds. This is an important point that you have to remember about cefazolin. Now coming to second generation cephalosporin, what comes under it? Cefaclor, cefoxitin and cefuroxime. What is the coverage of second generation cephalosporin? These are gram positive cocci, same as this. H. influenza, Enterobacter aerogenes, Neisseria species, Serratia marsacenis, Proteus mirabilis, E. coli and Klebsiella pneumoniae. So these are the coverage of second generation cephalosporin. You can remember this by the mnemonic HENSPEC, HENSPECK. H for Haemophilus influenza, Enterobacter aerogenes, N for Neisseria, S for Serratia, P for Proteus mirabilis, E for E. coli and K for Klebsiella pneumoniae, and this can be remembered by PECK only. Now coming to third generation, fourth generation and fifth generation cephalosporin. In third generation, which is the most important class of most important generation of cephalosporin, what drugs come under it? These are ceftriaxone, very important. Next is cefotaxime, cefopodoxime and ceftazidime. Very important point about this generation, third generation cephalosporin, is that they can cross the blood-brain barrier. Okay, so this is a very important thing, and hence, since they can cross the blood-brain barrier, we can give it in meningitis. So it is very important that you remember what drugs come under it. It can cross the blood-brain barrier, and ceftriaxone, which is a third generation cephalosporin, can be given in meningitis, which is of course because it can cross the blood-brain barrier. So what are the other places where we can use ceftriaxone? These are meningitis, gonorrhea, disseminated Lyme's disease, and ceftazidime is very specific for Pseudomonas. Serious gram-negative organisms which are resistant to other beta-lactam antibiotics can also be covered by third generation cephalosporin. So this is all for third generation. Coming to fourth generation, what comes under fourth generation? These are cefepime. Gram-negative organisms are covered under this. As I already told that the gram-negative coverage of cephalosporin increases as we go from first to fourth generation. So you can see over here, gram-negative organisms are covered the most. Increased activity for Pseudomonas. You have to again remember this fact. Now coming to fifth generation cephalosporin, that is ceftaroline. There is only one drug that you have to remember under fifth generation cephalosporin, that is ceftaroline. So what is the coverage of fifth generation cephalosporin? The coverage is of course both gram positive and gram negative organism. You have to remember this, and remember that I've already told previously that what are the organisms which are not covered by first to fourth generation cephalosporin. Those were lame, LAME, Listeria, atypicals, MRSA and Enterococcus. So these are the organisms specifically that are covered by fifth generation cephalosporin, except atypical. So Listeria, MRSA and Enterococcus will be covered, and both gram positive and gram negative will be covered. And most importantly, that you have to remember that it does not cover Pseudomonas. You have to know what is not covered by this than what is covered by this. This is more important. Okay, so this was important about third, fourth and fifth generation. Now coming to the last part, adverse effect. Adverse effects. So what are the adverse effects? Of course, hypersensitivity reaction will be one of them. Another one is autoimmune hemolytic anemia. I have to remember this. Third is vitamin K deficiency. Fourth, nephrotoxicity, which is more prominent when you mix a cephalosporin with an anti-aminoglycoside. When you combine these two drugs, the nephrotoxicity action is more. And lastly, disulfiram-like action. So what are the other drugs that you have to know that cause disulfiram-like action? Okay, so these are the 4 drugs that you have to remember by heart anyhow, and these are very important. So these are cephalosporin, of course we are studying it, metronidazole, glycofulvin and first generation sulfonine ureas. Metronidazole is an antimicrobial, glycofulvin is an antifungal agent, cephalosporin is an antimicrobial. First generation sulfonine urea is actually an oral anti-diabetic drug. So you have to remember all these 4 drugs. Now coming to the last part, resistance. How does an organism develop resistance to cephalosporin? The answer is very simple. Structural change in penicillin binding protein. What is penicillin binding protein? Penicillin binding protein are those parts where the cephalosporin or any beta-lactam antibiotics actually sit on and then do its function. So if you structurally change the penicillin binding protein, of course it will develop resistance for the drug. So that's it, guys. That's all for cephalosporin. It was a very important drug. If you liked my video, then please like, share and subscribe. Thank you.